Griffith, the Vice Chairman of the Oversight and Investigations Subcommittee. 5 minutes for your questions, please.
Thank you very much, Mr. Chairman. I appreciate it. This is one of those difficult issues, and I appreciate you, Mr. Chairman, holding this hearing because I'm trying to figure out exactly what I should do and how I should go on this. I was not decided coming in here. I lean towards voting for the bill because we've had problems for some time. I also have concerns on the privacy side, so let me go over some of those issues that we have. You know, as early as last year, we had Brian Moran, the Secretary of Homeland Security and Public Safety from Virginia, in. He said we got to do something, and it would help us to combat the opioid epidemic and save lives if we could have improved data sharing. And he specifically mentioned Part 2. And I do think, and Mr. McKee, if I could ask a couple questions of your situation, and I know it's painful, and I appreciate you being here today to discuss it. Your brother was doing well when he had the accident. Is that correct? Is that my understanding?
He had periods of sobriety and periods of relapse, and I'm not sure how many relapses and how close together they were.
Okay, fair enough, because he didn't tell you everything. And then he has this accident. And as a part of the accident, they had to do surgery. Was that surgery something that they did immediately upon him having the accident?
It was not immediate. He was stabilized in Worcester Community Hospital, and then he was driven to Cleveland Metro Hospital.
Okay. So here's the question I have, and you may not know the answer. When he's stabilized, did they give him opioids for the pain that he was experiencing at that time?
Absolutely.
And he was not fully conscious, was he?
No, he was making some jokes about the appearance of the nurse when I came to see him.
Okay. So here's what's interesting, and I have this theory, documentary archaeology. You can sometimes go into documents and figure out that people didn't realize what the future would hold. This bill was passed in the early 70s, and what you find in the bill is you've got a section on medical emergencies. Under the procedures required by paragraph C of this section, patient identifying information may be disclosed to medical personnel to the extent necessary to meet a bona fide medical emergency in which the patient's prior informed consent cannot be obtained. Your brother couldn't give informed consent, forget his abuse problems. He's just been in an accident. They're probably giving him opioids, and you suspect that, and I do too, before he ever gets sent over for the surgery, before he ever gets the prescription. And because of the way the law is written, or at least as it's been interpreted for the last 40 years, nobody knows that he has a substance abuse problem. So they've already given him substances before he ever has a chance to waive. So I recognize that. You see that problem as well, don't you? Yes or no?
Yes, Congressman.
Okay, because I'm just trying to get to the other side. Now, here's the other side of this. I've got this hypothetical forming in my head where the person who's previously had a substance abuse problem goes to apply for a job, and that job happens to be a covered entity who has access to all this information. And maybe they're not supposed to use it that way, but they have access to all this information. And let's just assume that this person happens to be a medical professional. Let's say a nurse for the sake of argument. And they're going to go to work for, say, an insurance company, working for the insurance company who is going to provide the health insurance because that's what they do. What's the likelihood that, notwithstanding the fact that we're never going to see the fingerprints, Ms. Metcalf, what's the likelihood that that nurse is never going to get that job, that he's going to be excluded because as they're doing the workup on the paperwork and so forth, they discover that he's got a prior substance abuse problem, and they'll never say why, but all of a sudden, oh, we found out we don't have an opening. What do you think those odds are?
It's a very tight job market out there. Of course, they're going to go with someone that does not have a history of a substance use disorder. That's the history of discrimination.
And my colleague says, why would they do that? And of course, maybe they would, maybe they wouldn't. I don't know. But this is the concern that people have with substance abuse problems in their past, and they're on recovery. They're doing well. They worry about these things. So, Dr. Clark, as my lawyer doctor on this team, here's what we need help on. There are some of us that want to find a balance, because without something as an alternative, I'm voting for the bill. That's what I've assessed today, because there's more good than evil. And even though I worry about the privacy concerns and agree with Mr. Barton and others, I don't have an alternative. Now, we got to fix HIPAA at some point, too. That's a whole nother discussion, Mr. Chairman. But But right now, I've got a lot of people. Nobody anticipated in the early 70s that we would have drugs so powerful that you would be addicted. 6% we heard earlier somewhere in the studies I've been doing the last week or so, 6% on a first use of certain opioids are addicted. 13% if you extend that out over a period of time. You know, we're dealing with a whole lot more dangerous drugs than we knew about when this bill was passed. So I'm going to vote for this unless I have an alternative. I don't have any time left, but if you can get me any answers, any advice on how we might be able to make this bill better or an alternative, I would greatly appreciate it. And thank you for you all listening and for your input today, and it's been very educational for a guy who was undecided walking in here. I yield back.